All right. So, welcome everyone to this special event with Dr. Gagné. My name is Aisha. I'm a certified teacher of Transcendental Meditation. I'll be hosting the session today. So, today we're going to be discovering the evidence-based benefits of Transcendental Meditation and learn how it's different from other forms of meditation. As many of you probably have experienced, there are so many different types of meditations these days, from guided meditations to yoga retreats and all sorts of places you can discover meditation. And it's quite common for people to put all meditation practices into one category and either say something like meditation doesn't work or meditation is great, everyone should meditate. However, different meditation practices have different procedures. And depending on what procedure you're using, you'll have different effects. So today, Dr. Gagné will bring us with him on a deep dive into the research that explains how transcendental meditation is a uniquely powerful practice. And you will also learn more about transcendental meditation itself, or as we like to call it, TM for short. TM is an effortless, evidence-based meditation practice that's taught one-on-one by a certified teacher. And at the core of this practice is the powerful experience of transcending, which is a journey beyond the active mind to the most subtle depths of our awareness. And from this inward experience of transcending comes these unparalleled life-enhancing benefits, which we're going to talk about today. And at the end of today's talk, you'll have the opportunity to learn how to start your TM journey by attending a free preparatory session with a certified teacher. So we'll start the session off with Dr. Gagné's presentation, and then we'll open it up for questions at the end. So write down your questions, make sure you're remembering them, because there will be time at the end to ask them to Dr. Gagné. Now, before we dive in, Dr. Gagné, let me just take a minute to introduce you to everyone. So Dr. Gagné is a medical doctor and former assistant professor in the Faculty of Medicine at McGill University in Montreal. He has been a prolific speaker on maternity care and the scientific research on TM, including its application in education and stress management. And on top of all of that, he also has 30 years of experience in clinical practice, teaching, and research. Welcome, Dr. Gagné. The floor is yours.
Thank you very much, Aisha. Thank you for inviting me. It's a pleasure to meet all the people from across Canada and give first a bit my own experience with the practice of TM. And then I will go into the evidence-based research about TM that allows me to recommend it to my patient, and I did for many years. And but it all started with a personal journey. I'll just tell you briefly a little bit how I got there, and it was at the end of my training as an obstetrician and gynecologist at McGill University, and in the middle or toward the end of the training, I needed some rest. I was kind of overwhelmed by the work and responsibility and the night calls and pretty much getting kind of exhausted by the training itself and seeing all the burden of the work of this career in front of me. And I must say, I was looking for some relief of stress and fatigue and so on. And it's from back then, that was at the end of the 1970s, beginning of 80s. So that's a long time ago. I just got on, I was on call, and I just almost by chance, probably the best chance of my life, I got this journal, this scientific journal was just left there. And I was waiting in between two calls, and I started reading this, and it was about transcendental meditation and about the fact that there was some research. It was a medical journal, and it says that there are some research saying that it actually reduced stress, and they were measuring the skin resistance. These days, they didn't have all the fancy method that we have today with brain imaging. And they had some research saying that the blood flow to the brain was increased and heart rate was reduced. And then there was a good news for me. It says oxygen consumption during the practice of TM was reduced more than during sleep. And that would equivalent about, that was maybe 20 minutes of TM was equivalent about of 3 hours of sleep. Oh, that was what I was looking for, because I had to do all these night shifts and sleeping was kind of becoming a problem, time to sleep. So I said, oh, I need this kind of rest. So that was a personal journey that I needed to. Then I went there and I took this technique, and I must say that immediately, just immediately, I was taught the technique by a TM teacher. And when I closed my eyes and I started to apply the technique, it was boom, exact. It's like cutting the cable of an elevator, and very quickly I went into this space of silence that I never knew, despite my knowledge in medicine and all the, theory about physiology that I knew. I never could imagine that I had this space of calm and silence and deep silence inside. I never, my cognitive, my mind never had experienced this. See, it was quite a very interesting. Just immediately, it didn't take any time. And in the days after that, I found the results were striking, for effectively helping me cope with the the situation I was facing and all the emergencies and calls that I had to take care and everything. So it started as a personal thing, but I was so surprised by the the rapidity of the effect and the depth of the effect that I kept being interested into research. Then you see, I have no merit to choose TM because there was only that available in these days. Meditation was kind of a new thing in the 70s. It was related maybe to the, this time of the hippies and on all of these things. It was associated to this, but I quickly realized there was some very interesting power. It was not related to any belief or any, didn't need any change of my life or my lifestyle or my diet or whatever like this. It was something that I could use myself just twice a day, just flush out all the stress and be ready for another active period. So I said, there is something there. And so over the years, I've been following the scientific research on TM and other meditation. And I think also for my own interest, I took some other uh, techniques, I just tried it in order to try what was there. But I always found that TM was just the best. And as a physician, in order to be able to recommend it to my patient, I needed some scientific proof, and I wanted to make sure that I was suggesting something valuable. And so it was valuable for me, but you need some other more specific research about this. So this is a bit of the on this basis that I'm going to uh, talk to you about TM today, about all the actual research that makes it now a very scientifically proven ways of improving health and behavior and well-being, everything else. So let's go there. That's going to be, this is the way we're going to go. I'll just share my screen. Here we go. So first, we, as I said, and also Asia described us already roughly what TM is, but we're going to go in a little bit more detail about the practice. But today, we will not learn about how to practice TM. It has to be taught personally from one to one, like Asia said. So it's gonna, we will look at the principles and the effect, evidence-based benefits. Okay, so basically the first thing is meditate. Like Asia said, meditations are not all the same. Uh, there was a you see, over the year, when I was watching the evolution of scientific research about meditation at large, there was such a so often common mistake. Even in the scientific literature in the 90s, it was very, very common that you will see a paper published about meditation, its effect and everything, and without mentioning exactly what the technique was and kind of mismatch different evidence about different type of meditation thinking, because scientists were assuming that meditations is just meditation. That's all there is. But it's only around at the beginning of the 2010 or something like this that the scientists finally agreed, the scientific world finally agreed on a classification of different type of meditation. So, but among on in this classification, TM is unique. And that's a bit of the plan that I'm going to discuss the presentation today. This is the plan. First, how TM is it unique really, and is it scientifically very well demonstrated? And Asia said at the beginning, TM is a simple and natural technique, but how scientifically can we demonstrate this? What are the evidence to show that it is simple? It is most likely, I can say, the simplest type of meditation to practice. It's also effortless. We have some evidence now showing this because that was taught, even me in the 70s when they told me about TM, they said it's natural and simple and effortless and everything like this. And I found that it was true from my own experience. But do we have evidence? And how do we see this actually happening in the scientific literature and also in the brain and when in the result of TM? Effortless. TM is also highly protocolized and standardized. For me as a physician, it's very important. It's like medication, if you medication and meditation. If I prescribe a medication like an antibiotic, I want to make sure that this antibiotic is always the same, like it cannot change, that's the formula, the results and everything are repeatable and it's the same and all of this. So, but you see, TM is highly protocolized and standardized. You can learn, I learned TM in the 1970s, and I've been sending my patient, and then even some people of my family just went there late. Just recently, somebody came. You are taught exactly the same technique, exactly the same way. It's very standardized. And in research and in medicine, when when you suggest this, it's very reassuring that wherever you go in the world, you can be taught the same technique in the same way. So in this way, you can go back to research, and I'll show you some of these research in the 1980s or something, and they're still talking about the same technique. It's not always the case for many kind of meditation because they're evolving, they're a bit new, or maybe over time, They don't have an organization that supports the teaching and make sure the teaching is always the same. Anyway, some of them are more standardized, but many of them are not. So if as a professional, you want to suggest something that is very standardized, and then once we see that it all standardized, it is, but I just gave you pretty much the argument about this. But something that is unique about TM, and the word here is brain integration. Brain integration means the capacity of the brain, the different parts of the brain to communicate naturally and fully all together, so that the brain is fully integrated. By comparison of the brain to be, just scattered period, part of the brain not communicating enough with each other. So TM bring this capacity, this brain integration. We'll finish with this, but you will see it's very impressive, the research about this. So let's go there. Let's start. First thing is, I told you this scientific classification of different meditations. It was finally kind of came to an agreement in the scientific literature about in 2010. So it's not so old. It's recently actually that they came this, and I was very happy to see this, because then it's kind of took care of this confusion that there was in the scientific literature. But despite this, just recently there was a report on television, and they were talking about meditation. It does this and does that and blah blah blah, and sometimes there are side effects and everything. And they did say meditations are all the same. Despite this, they say nobody ever in this report, mentioned that, it depends on kind of type you do and the length of the practice and blah, blah, blah. Anyway, there are still some things to fix, but anyway, the agreement is now there are 3 types of meditation, and they're classified by the level of cognitive control that you have to use to practice. The first, with the most effort, is focused attention. It's a kind of a concentration, and this is like example of this is Chinese. It's a Chinese tradition, Tibetan meditation, loving kindness meditation, or something like this, if I remember well the name. It involves taking a thought or a feeling and keep your attention on it. Keep your attention on it at any cost. If there is some kind of mind wandering or some other thoughts that come and disturb this, you have to push these thoughts out and make sure you concentrate on this. So of course, it's a work. It's a cognitive work. You have to be doing it properly, and it takes some time to master it. It's not immediate. So anyway, so that's most effort. Open monitoring is when dispassionate observation. It's more like Buddhist tradition meditation. Mindfulness is there, and it's considered some kind of a cognitive behavioral therapy. So you develop distantiate yourself from feelings or anxiety or ideas that you have and everything. So it's you put yourself into observation. You become an observer, right, of the cognitive process. But still, you have to observe. It's not completely effortless. There are some effort there, medium effort. Automatic self-transcending, TM is there, and TM is the only one that I know. I've looked at the scientific literature about meditation. I never found something exactly like TM for we call it automatic self-transcending, because, and it's classified this way because there's the least effort. There's basically not much to do It's an automatic process that bring you down to transcending. And as I said at the beginning, my experience of that was very strong at the very beginning when I started. But then it was my experience, but is it the experience of other people and everything like this? So science should answer these questions. So we're not gonna learn about TM, but I just want to give you an practical example of this classification. Huh? When you learn TM, very often the TM teacher will use this analogy, the analogy of let's say an ocean, or you see the ocean, there are waves on the top, but then if you go deep down into the ocean, it's very quiet at the bottom. Even if there is a storm, on the top, the bottom is very quiet, okay? The bottom is always quiet, actually. And then it's like the example is that if you see a bubble of air coming out from the bottom of the ocean, there is lots of pressure, then it's going to migrate toward the surface and then become bigger, bigger, bigger. And then at the top, it's going to be a conscious thought. It's like you can imagine the thoughts, they come from somewhere. And now we actually know where they come from, the default mode network. Oh, I'll come to it later, but this analogy is actually exists in the brain. But it's easier to understand that the mind is active at the surface and quiet at the bottom. And these are waves. Waves are different thoughts. If you practice focused attention, let's say if you have focused attention, you will take a feeling or a word or an idea or something like this. It's like putting your attention on one specific wave and defending it so that no other waves can come and disturb it. So that's the other wave would be mind wandering, because if you close your eyes and you try to meditate, there will always be some other thoughts coming. Mind is always going, always going. So when you do focused attention, you have to work at, maintaining your attention. So it's more effort. If you do open monitoring, like mindfulness, it is like watching the waves go by and just making sure that you just keep watching. If you get disturbed by some other mind, your mind start to wander outside of your observation technique, then you have to bring it back there or on the breath or any things like this. So it's less of a effort, but you're busy doing something. TM is different. What they do is the teacher give you a mantra. The mantra is a sound with no meaning. Okay, so that it's like it's a wave, but because it's very natural and attractive for the mind to go toward, if you leave it, if you let it go, it's going to start bringing down the mantra. It's going to refine the mantra. It's going to refine, and then eventually disappear. And then you get at the source of thought that they call the self. It's called yourself. You're kind of, it's a deep dive within the cognitive, the consciousness has some different level, subconscious, this fragmented at the bottom. But psychologists, everybody knows that there are some levels. So you go down there and you experience the source of thought. Source of thought, it's like the mantra disappear, and then you experience cognition experience itself. It's like the consciousness experience, there's no thoughts. So then it experience itself. Doesn't last too long, but there are principles, they explain it to you what to do. So it's really a dive into what you are, self. Huh? And we'll see that later, but you see, this is what they explain to you, and I do the way I explain to you is it possible very much that, see? Then we'll get to that. There are now research saying that this is actually happening. Anyway, so this is a big dive. Let's go into, yeah. So this classification of the different type of meditation does not come from just oh well it's a big work when you do focused attention, or it's less work and less work. No, there are actually some evidence that it does exactly this, you know. So like focused attention meditation, any focused attention meditation that you put the EEG, you measure the brain wave, you will they will notice gamma brain wave. This is the brain wave of attention. Exactly, concentration. When you concentrate on something, the brain wave, they become very, very fast and like this, you know, it's very, and it's externalization. It's outward looking. Even if your eyes are closed, it's exactly the same thing if your eyes would be open and look at, let's say, a candle light and just fix it, or doing a very engaging task, you know. So that's attention. So you're looking outward, even if your eyes are closed and you're just uh, doing something with your mind. Open monitoring will, it's more like you're observing. So evaluation, but it's still outward, but not as much outward, but it's still. And you see, automatic self-transcending will give you a completely unique kind of tracing of the brain, the activity of the brain. It's called alpha 1, actually, from 8 to 10 cycles per second. This wavelength is self-referral. It is inward looking. It's like exactly what it says is that if you're very quiet and you think even about yourself or something like this is sometimes going to give you that kind, for short period of time, this kind of tracing. But during TM, it's just across the board. You just inward looking, inward plunging. That's what happened to me the first time also. And it was obvious that it's something different. So this is it. This is we will go back to this alpha activity. I'll show you later about this, but that's why the classification is very scientifically established. And there is also some brain imaging that shows different brain imaging for every one of these practices. And I'll show you one later. So basically, here's the conclusion. I know it's very busy, but it's important to understand that TM is unique, and you see how unique it is compared to open monitoring and focused attention. You see cognitive control. We already understood that there's no cognitive control with TM. It's an automatic process. Open monitoring, moderate control, focused attention, maximum control. Mind wandering, we spoke about this. You have to suppress mind wandering when you do focused attention, but you don't suppress it, but you kind of control it with open monitoring. And automatic self-transcending, it's undirected. Mind wandering is not considered a burden, something abnormal. You welcome it, and you can deal with it with the mantra, and it's part of the technique, but there is no problem with mind wandering. Then, you know, because of this very specialized way of going in and experience this deep rest, thalamic activity is reduced. It's the only meditation also that the thalamus is at the center of the brain. It receives all the information from the senses and the body and everything. And then it shoots it back to the cortex so that the brain can make a decision about what's going on. But when you're practicing TM, this becomes very, very quiet. And because it's very quiet, it produces this very deep rest at the level of the body. We'll show in the next slide. Yeah, and then after, so it's reduced and basically because of the activity, the work that this brain has to do with open monitoring and focused attention, it's increased. So it's the only one that reduces this thalamic activity and will produce this big rest at the level of the body. The FOMO network is a new discovery, was discovered in 2001 by a neurologist in Washington called Marcus Rakel. It's very nice to see how he describes it on YouTube. Yesterday I was looking again at this just because I hadn't looked for a while. The FOMO network is actually, he says it himself, he discovered probably the self, what you are, your personality, all your wisdom, everything you know from the past, and your capacity to envision the future, capacity also to see the feeling of others, like compassion, things like this. It's there, and it's a breakthrough discovery that there is this space in the brain of everyone that contains your personality, kind of, okay, and that is reduced. The thing is about this, and he explains it very well. The FOMO network, when you do a task, it's it goes in the background. It's you see the brain. It's like it cannot maintain two at the same time, or relatively. And he says it this way. He says it's like when you do a task, you lose yourself in the task. That's his word. You lose yourself in the task. And then when you stop doing a task and you become very quiet, then you recover what you are. Okay? And it's very interesting. So it's increased when it's the only, and because it's effortless. You see, when you practice TM, you're not on a task. Then your personality, you get to know it, you shine. And then when you can come off of meditation, the best quality of your personality will shine again. I mean, you cannot get that anywhere else. And we'll get to it. I'll show you the research about this. The EEG pattern, I just told you, there's the alpha and then the gamma is very active and you're on the task. And the alpha, you're just with yourself. Okay? And also, but there is something very peculiar about this alpha activity is that it's extremely coherent. It increases the coherence of the brain wave. I'll show you this. And that's also very powerful. And the only technique, meditation technique that increase brain wave coherence is TM. And I could show you all the articles, but I don't have time. But it's if you look at scientific literature, you'll see open monitoring reduce and no focused attention reduce the coherence in the brain. So we're off to a good. We're just starting the presentation now. Okay, so I told you about the thalamus that was reduced. This is one of the first scientific discovery about TM that I saw at the beginning of the 80s, and I was very impressed. They said that it created this experience of restful alertness. Restful alertness. Because now we see it from in brain imaging. You have brain imaging showing it. But back then, they were measuring it by the oxygen consumption to the brain. That is, blood flow to the brain is increased. Blood pressure in the body is lower and the respiratory rate is lower anyway. So they were describing in the 70s this restful alertness, saying that the brain stays very active, but the body is extremely restful. So this is a bit paradoxical. Me as a physician, I said, how can it be? Because normally if my brain is very active, my body also is very active. And if my body, I lie down to sleep, the body will start resting and then the brain will just go. Okay, usually they go together. Now with TM, what's happening? You see it. you have the upper part of the brain, especially the frontal lobe, become very active during the practice, become very active. But at the same time, the bottom of the brain, the lower part of the brain that contains all the, how should I say this? The thalamus and the bottom of the brain, cerebellum and the pons, they are the automatic process. They drive they're the automatic pilot of this of your physiology. They drive the respiratory rate, the heart rate, glucose, everything, the hormone level, everything is driven automatically without you having to do anything. It does it by itself. Okay, so all these automatic process, they quiet down during the practice. But while the brain is just rewiring itself and with the alpha activity, I'll show you later. But anyway, so restful alertness is probably the reason for many special unique effect of TM on stress, cardiovascular, and then even personality change and everything like this. So just remember restful alertness. I'll give you a practical example. What does it mean? I close my eyes. I have this restful alertness. Then I open my eyes. What's going to happen? What will be the difference? Okay, because only 20 minutes. So these two studies here are good illustration of this. The one on the left, well, this is the same population. In the US, there is an epidemic of high blood pressure on kids, actually they are teenage in school. And especially in the racial group and everything, they have so much stress or whatever like this. They have this problem of high blood pressure. They're very young. So people were saying, well, we should not, starting taking pills for the rest of your life is quite a long time when you start that young. So they are obviously looking for non-medication techniques and everything. So somebody decided to do an experiment. They took a group of these teenage with slightly high blood pressure, not very high, but some risk factor were there. And one group was the TM group, the other group was the control group. Okay, so they taught them TM. You see, and after you see only after 2 months here, blood pressure was already very low, and after 4 months, blood pressure was back to normal on these kids. They were practicing TM at school in the morning and before they left the school in the afternoon. So result was very good. And then after that, this research was over. Researcher went home. The kids, the school teacher, they did not keep doing the meditation. They had to do it at home by themselves if they wanted. If they didn't want, they had no time anyway. Anyway, so just for fun, the researcher came back another 4 months later and the blood pressure on these kids was still low. So that's another thing. It's very quick. And then this kind of rest that you have in your body after a few months of practice of TM, it stays. It's like the body learns to be more quiet and everything. Despite the fact some of them kept going, some of them did not, but the blood pressure was nice, was still good. So that was restful body, lower blood pressure. Now, alertness, what did it do? The same population show beneficial effect of TM on absenteeism, rule infraction, and suspension rate. So these kids, these students, just by practicing TM, they became better students. Thinking was more clear. Okay, that's the alertness. Thinking was more clear. They decided that school was good for them, maybe for the future, because you see, the default mode network give you the capacity to envision the future instead of looking just in front of you. So this activation of their default mode network that we saw previously, that you see only with TM, change their way of the vision, their perception of what I do as a student and everything like this. So remember this. So on this same population, they had both effect on the higher brain and effect on the lower brain. Even after the practice, I mean, they became better. So that's interesting. But now let's go a little bit further on this restful state. The restful state is so profound that the American Heart Association in 2013, they put up a committee of expert cardiologists together to find some alternative to medication. They said, if we want to avoid medication or help medication working, what should we do? Is there any alternative and everything? And it's the Dr. Brooke here published this paper in 2013, and it says basically about meditation. There were other things like diet, not diet. They weren't speaking about diet, but exercise and meditation and yoga and all of the other alternatives that you can find. And they finally conclude that transcendental TM is the only meditation practice that has been shown to lower blood pressure. Okay. But then, and that was very impressive with me, and it's very encouraging for a physician that you're right in recommending to the patient. Other conclusion were that TM practice is associated with a substantially reduced rate of death, heart attack, and stroke. So not only it can lower the blood pressure, but you have all the preventative effect of that, even better than pills. Okay, so that was kind of a breakthrough. So you see this restful state that TM gives, it stays in the body after that, and it relieves all the tension and the pressure and so on. And just to tell you, because me as a physician, I say, should I really prescribe this to a patient? So this is his opinion. He was interviewed, the Dr. Brooke. So I'm not the only physician saying this. He said it also. TM stood alone among all of the meditation technique because of the great deal of research and corroborative evidence. Okay. Corroborative evidence is an important aspect of this phrase because in order to make this conclusion, this committee did not look only at the blood pressure. They look at everything else that TM does. And they looked also at the neurophysiology I just told you about, that TM is quite unique and blah, blah, blah. If you don't look at the problem now in the scientific community is that people are not connecting the dots. They're specialized in this, they specialize on that, depression or so. But then when you look at the overall picture, it's really convincing. So that's what they did. That's why they came to this conclusion. And I'll just show you here what they meant by corroborative evidence and reduction in cardiovascular complication and even death. Okay, so here this was a study about 202 subjects, mean age 72 years old. They were all with some cardiovascular risk or even previous cardiovascular events. So they were on medication, they were on followed by the physician and things like this. They divide them in two groups. One group was TM, the other group was just business as usual, treatment as usual. But the group TM was also on the usual treatment. So what they did is they followed them for about 9, 10 years. And you see here, it's a graph of survival, mortality, also cardiovascular event. So you see the green curve is the TM group. They're always above the other group. And here you see after 6 years, this group have 20, 27% had an event, cardiovascular event, whether it was mortality, myocardial infarction, or stroke. Only 15% in these groups. So it's a 48% reduction. All-cause mortality, 40% difference between the two groups, including 49% for cancer. Nobody was expecting that I'm going to have a result on cancer because I'm on cardiovascular, but this was a kind of an extra, you know. And even at the end, 9 years after, 10 years after, the group was always having a little advantage just because they practice TM. Okay, at 72 years old, it means that even at this age, after collecting all the stress of her lifetime and having had already some complication with health complication, everything, TM was still able to remove a layer of stress or, you know, disturbance in the physiology, whatever. Life expectancy was improved by 23%. Talking about life expectancy, I have another for you. That was one that I saw in 1982. That was just, I was about only 1 or 2 years, 3 years into my TM practice. And I see this study here. They took a group of people, 53 years old of age, and then they measure the biological age. Because you have your chronological age, your age is in number of years. But then if I get you through some tests, some people are older or younger than their age, actually. So basically, here is the joke about this, because you can be forever young with TM, meaning that for just roughly, I mean, it's more complicated a little bit, but for every year you practice TM, you become younger a year biologically. It kind of, because there were some other um, research done about this later in the 90s. And it seems like it's plateaued a little bit at 12, 10, 13, 12, 10 to 12 years. It's not bad anyway. It's good. I see, I did not say at the beginning of the meeting, but I'm 92 years old. Not quite, not quite. But I'll tell you my own experience with this. When you're young and you start practicing TM, you are biologically younger than your friend that is not practicing TM, but it won't show at the beginning. Because me, I was wondering, you know, I'm practicing TM, I'm going to be just bragging them that I'm much better than they are. It did not start to show before about age 50. Then when you get to 50, 55, 60, 65, then you see the friends and the people in the family not practicing TM because they say it's not for me and I don't need it and blah, blah, blah. But they become, health problems start to show and they also look different. So that's the forever young. Okay, that's the message. So continuing on the cardiovascular disease, you have the effect on metabolic syndrome. I won't go, it's a bit complicated. Metabolic syndrome is cholesterol, high blood pressure, and diabetes all together in one person. It's a very high risk for cardiovascular disease. So they made this in 2006. That's one of the study that Dr. Brook looked at. And they had amazing results with TM, with metabolic syndrome, especially that was the first time that a simple mental technique would give reverse type B diabetes. Reverse diabetes, actually, type B, not the juvenile diabetes, the one that the adults, they have. So anyway, very good answer. But Dr. Noel Berry Merz, he was interviewed and people say, why did you pick TM? Why not another kind of meditation? And he said, well, TM has been studied the most and the most rigorously in a randomized controlled trial. He said himself also, and I'm very happy that I think the same also. It's highly protocolized and standardized. Because when you're a researcher and you spend $1 million on a research and you find that it's good, you want to make sure it's reproducible, that anywhere you go, you can have this. It's like a pill or like a, so TM is like that. And he says also one of the good thing is TM is trademark so that you're sure you have the same thing everywhere. And it's being verified that the teachers are well trained and they give the good services. You have to be a certified instructor to teach it. Anyway, so that's, I just want to say that it's being more and more recognized that it's a worthwhile technique to adopt even in medicine. And to go even further into medicine, during the pandemic, now we're going into we're, we were all on the thalamic reduction and the stress and everything like this. Now we're going into the ease of practice. I told you my experience, but during the pandemic, and I know I was there, I was there during the pandemic, also working, and it was a very tough time. And many healthcare workers were burning out, leaving, and hospitals were so stranded by the problem that they were afraid that there would be nobody, lack of manpower and so on. So one doctor in the US, that was in Florida, Nestor, Mark Nestor, decided that to go test this TM for his healthcare workers, physicians and nurses. Just quickly, the results they were quite surprising even to me because these doctors, they were skeptical. I don't think it's going to make a difference. It's because we're overwhelmed and we're overwhelmed. It's not going to change because I close my eyes and I do this. So they were so severe about the research that they wanted to have a 2-week check of the efficacy of this. And they said, if there is nothing, we're not going to waste our time. I mean, doctors, how they are. Anyway, so what happened is that, and it was the first time somebody did that. After 2 weeks, there was a 45% reduction of depression, anxiety, somatization. I told you, I put only anxiety there, but the other are the same. And even insomnia after 2 weeks, 33%. When I said that I had the same experience 40 years ago, actually, I had the same experience, very rapid, just like that. Relief of this, they had the same experience. But then the relief kept going to 62 and 44%. So this Dr. Nestor says, this rapid and dramatic improvement in stress-related symptoms is not often seen with the use of medication, much less with other easy-to-learn mental technique. It's not only me saying this. He took the TM practice and he says, so easy, and then you get relief in 2 weeks. Okay? So that's another thing. But now, these were healthy people at the beginning. They were just stressed out by the pandemic and the work and everything. What about very sick person with accumulated stress to the point they become debilitated, like PTSD veterans? PTSD veteran, that was also a recent study in 2018. These vets, the veterans, I mean, I read the study. They were very sick. And the gold standard when you have somebody very, very sick of PTSD is prolonged exposure. This is the yellow column here, prolonged exposure. They compare TM with prolonged exposure. Prolonged exposure, you have to be a psychologist with almost a PhD, specially trained in this, and there's not many of these guys. And prolonged exposure, it's a difficult psychology treatment because you have to be exposed to your again and again to your trauma in order to be able to accept it or to relieve it and everything. Anyway, it's 43% of the people just quit this treatment because it's difficult. TM, it's such an easy thing. You can find it in anywhere you live in your city. There will be a TM center and a teacher to teach you. It doesn't cost almost compared to prolonged exposure, very costly. Anyway, you see, TM is the blue bars. It just was better in result than it is for prolonged exposure. And prolonged exposure is a gold standard. It's supposed to be the best. So now they've discovered that a simple mental technique can quickly relieve even deep-rooted stress. Okay, deep-rooted stress. And that's what they told me also in 70, 80 or something. They said, it's very good for stress. When you have some experience during your meditation, these are the stress being dissolved. What do you mean by this? I mean, but now there is new research shows that repeated stress, they end up being uh, picked up by DNA. Okay, your DNA, if you have this is probably the basis of PTSD also because the stress it's when you're at war or something, it's repeated stress. Then eventually the physiology has to remember, it has to organize itself. They organize itself. That's a long story, but there was this article here. It says TM reduced the expressions of conserved transcriptional response to adversity. CTRA. CTRA is a group of genes that remember the experience you have. It's a protective evolutionary reaction to for the DNA in order probably to prepare you for the next time. If you get attacked by a wolf or something like this, and then you have to learn, and it's repeated, then you kind of want to be able to answer more quickly. So DNA remembers this. The problem is that it piles up, and then you become the CTRA. One of the problems is that it creates inflammation at the cellular level, and it reduces the immune system. It's protective in one side, but it's damaging on the other side, especially when there are too much. So CTRA build up, and then your health goes down, and then you have inflammation at the level. I must say, I don't want to make it too long, but inflammation is the new culprit now for any disease. Now it seems like cardiovascular disease, even cancer, always start with some inflammation somewhere, and then it gets out of control, okay, at the cellular level. And TM is now shown, it was shown in this study, to reduce the CTRA, the CTRA and then reduce inflammation and improve immunity at the DNA level. Incredible, that a simple mental technique could have an impact at such a fundamental level. This is mind-body discovery of the mind-body coordination or relationship that never anybody could even dream of before. Okay, that's something very significant that we're discovering. So I'm passing time, huh? Time is passing, huh? I just want to, I like this one because as an obstetrician, I had a lot of experience with that. TM reduce the reaction of the brain to pain. Okay, and it's also an interesting study. After 3 months of practice, first of all, I'm going to try to make it not too long. But after only 3 months of practice, you see, that was done in the laboratory. It's a lab uh, mimic of a pain. They dip your hand or your finger into icy water, okay? At the beginning, it's only cold, but if you try it, you will see that, after a couple of minutes, it's become a bit painful, and after 5 minutes, it's very painful. And then eventually, you have to remove your hand because it's freezing, okay? So they tested this capacity of the brain. If a non-meditator, okay, you put the hand there, and then the brain will react in a global way, like the researchers say, it's like chicken pox, all the brain light up, I'm just, no, I can't stand it, I can't stand it, I have, okay? So this is the normal reaction to pain. 3 months of TM, 50% less reaction, okay? But the, the practitioner and control did not differ in the rating of degree of pain. The pain was 9 in 10 for both group, but the TM group at 50% less. How to explain this? They say that there are two component of pain. Objective, the degree of pain, the origin of the pain is objective. Subjective is, how do I suffer from it? How do I consider it bad? Or, this is the affective motivational. This is called scientifically this. But basically, I call it suffering. You see, in maternity, it's delivering a baby, it's like a big experience, and it's quite intense. And you need to be able to cope with this. And in my experience, my patient that went for TM and they go for in labor after, they don't have to practice TM during labor, but only 3 months of practice will relieve them of 50%, not of the pain, but of the suffering. Experience is better, the more satisfaction, the labor will be much smoother, much faster, because they don't interfere with what's happening. Anyway, so have you seen before a small mental technique, easy to practice, that only after 3 months can get rid of 50% of your suffering in life? Me, I've never seen. I've been looking for that, and chronic pain people and everything. And when we looked at, you see the always getting younger with TM, you see that over time, that people start, when you're in your 60 or 70 or something like this, then little things can happen and you're bothered by this or that or this or that. But you see that people practicing TM, they cope much better. They stay happy and everything. So it's an important thing. I needed to show you this. Now, just quickly, we should talk about EEG coherence. You see, when you close your eyes, and we just record the EEG on the brain, the brain waves. When you close your eyes, the back of the brain is the side, the vision. When you see something, it get projected to the back of the brain, and it's like of a screen, or that's where you see things and you interpret. So when you close your eyes, all of a sudden, your vision is turned within. Okay. And alpha activity, you see it's different, because this is the front of the brain, this is the middle, this is the back of the brain. You see, these are electrodes. So the back of the brain starts to look within, because my eyes are closed, so I kind of look within, okay? That's about the only place for normally that you will see this alpha activity. There's not much only when you close, everybody, when they close their eyes, you have this alpha activity at the back of the brain. When you practice TM, you close your eyes and you practice TM, you see alpha activity is now all over the place. It's not only at the back. It's very important, because it's called EEG coherence. Then there start to be a connection between the back and the front of the brain. And also the coherence mean that it's kind of a synchrony. You see this very synchronous here. These waves are all the top and the bottom and everything are. Anyway, it's more complicated than that, but it's called EEG coherence. It means that the brain is connecting not only the back, the front, the both sides and everything. So it means EEG coherence. TM is the only technique that gives this practice because of what we saw earlier. When you close your eyes and you start to EM, you dive deep inside. It's not only closing your eyes and diving here, it's diving more. So then the whole brain start to enjoy this. And then alpha activity, which is self-referral, what you are, it shows, okay? Just to show you, EEG correlate with a lot of good things. Actually, everything good about the brain, it's related to its capacity to be all wired properly, okay? Intelligence, creativity, learning ability, academic performance. I'll let you, we don't have time to look at all of this, but it's very good, you know? And it is so good that you see this activity of alpha now recently was studied. They called it E-Loretta analysis. They found that this alpha activity comes from the default network. Okay, default network here, it is a picture of the brain, but you're looking, it's the bottom of the brain. You're looking from below here, okay? So you see the default network is here in the frontal cortex, and it's here at the back also. But you see their medial structure. Huh? They are between the two hemispheres. And then when you start a TM, as we saw, the whole thing gets connected, and it means that both hemisphere starts to know each other, connect each other more. It's always connected, but it's just improving the connection every time you practice. So what it does, you see, you have the two hemispheres of the brain. One is subjective, it's a feeling. The other, this other one here is the thought producing. It's the objective, subjective. It's like the heart and mind. Heart and mind. The left one is the thinking brain that you do calculation, 2 plus 2 equals 4, but then you have the other side. So when you connect both together, it creates this self-actualization. It creates integration and stability of personality, self-regard, emotional maturity, capacity of warm interpersonal relationship. Now you remember the student at the beginning, how they became different student only after 4 months of practice of TM? This is it. This is what their personalities start to shine. They start to be able to look forward more in the future, and they stop making mistake, okay? Stop making mistake. They have better judgment because it's all wired. And then they understand others more, compassion. And it also improves emotional intelligence, which is, I don't have time to do too much, but self-actualization. Psychologists consider this, the level of self-actualization, as the best way to evaluate the personality of someone. And they have noticed that it's usually the score. Huh? You can, it's a pen and paper test that you can have. Then they score you. The score usually plateau around 20 years old, 20, 22 years old. That's it. This is what what you are, and that's what you will be for the rest of your life. Your personality, the quality, how nice you are, or how difficult you are, or whatever like this. So it's about 20. So, but this astute Alexander here, what he did is that they were university students. He had the score when they left university, about 20, 21 years old. Then he went back to see them 10 years after, but they were practicing TM in this university in the US. They were all practicing TM. So he went back 10 years after and he saw 30% increase in their score. It's usually considered impossible to change the score of self-actualization after about a certain year. Same for emotional intelligence. You get that when you're young, and then after that's it. That's what you are. See, when we see that TM can actually improve your personality, that beyond what you are actually, it's very interesting. Favor psychological well-being. It's linked emotional intelligence. It's linked to organizational effectiveness and blah blah blah. You see, it's not enough to be intelligent. You certainly have come across very intelligent people. They're actually jerk, or they have no sense of friendship or something like this. They don't behave properly. So and we see a lot, unfortunately these days, even in the news, you have but this is we used to think that you're stuck like this, but it's not true. There is a way to improve this. And if you go and see Marcus Rakel, I told you at the beginning about the default network, he says exactly the same. He says we thought it was impossible to improve personality, but with the DMN, the default mode network, we can do it. Anyway, so this is one thing, but this is called brain integration. You integrate the left and the right side of the brain, and they all now work, the heart and mind together, okay? What does it give on the long run? Well, this is this is the study. I'm almost done, now, but we're past time. You see, there is a researcher, Dr. Fred Travis. He invented this brain integration scale. You can actually put someone on a brain EEG, and then with some test on the lab, you can actually measure the brain integration score of that person. So he's been going around and doing brain integration score in many kind of situations. They went to Norway, the Norwegian athletes, the Olympic team. Okay, so they picked the best athletes in this team, and they also pick the best athlete. They had won at least a gold medal at the Olympic or World Championship a couple of times. So they took the best one. And then in the same team, having the same training, some of these athletes never got so high in their achievement, okay? So guess what it did? Comparison athlete were the average athletes. And the world class athlete, this is their score. This is brain integration score. You see, brain integration score is that. It seems like the more and more, they did the same for top level manager. When you're a manager and you have success, it's probably because you have a better score. These were not meditators. They were not practicing TM. It's just the way they are. Some people are born with a good brain and they do much better in life, okay? But look at this one. 10 weeks of TM. It's a bunch of students. I think it's, forgot now, I think it's Washington University or something like this. They 10 weeks, a college student, they practice TM. They have brain integration higher than these champions. And after 25 years, 24 years, well, now, I mean, this is over the roof, okay? And see, now, the big question is, if this guy, after 10 weeks, he is so high at brain integration, is he going to be able as good as this athlete? If you become athlete, you have to be an athlete. You're not going to be champion in another field than you are. If you're a pianist, you're going to be the best pianist, hopefully. But still, we're waiting for long-term research at finding if this guy here will really be the top of his group. Okay, but we have some preliminary result about this. This is this school in the US. They have a school where they learn TM very, very early, and this is called Maharishi School of the Age of Enlightenment. And there were a couple of books written on this because this school, all the kids are just top. They are higher than every other school in the world almost. When they compare themselves at international events and everything like that, in sport and in school, both. So you see, it's only a picture about this. So it probably works. If I was you and I was young, I would take TM because that's very likely to guarantee you to reach the top of your field, whatever it is. Anyway, so that's my opinion. Okay, let's finish with this. I hope you enjoyed, and I think you understood the following thing. TM is unique. I don't think there's any question about this in its way of working and its capacity of giving all these. It's simple, very natural. It gives very quick results. You don't have to master this. You see, many other technique of meditation, you have to work in order to become a master in this. I don't have time now, but I could tell you the story, the studies about this, but very quickly you get it. You don't have to work anymore at it. It's just natural, and then you just enjoy the benefit. Anyway, simple, natural, effortless. And you see, I wanted to show you the global brain integration and wide-ranging effect on health and well-being. That's my opinion, and I'm happy to answer your question, and I'm still very willing to recommend it to my patient. I'm not saying that other meditations are no good. No, no, no. All meditations can have some beneficial effect. And if one of my patients says, I practice this kind of meditation and I'm very happy with it, I said, you can keep going. But I said, does it really, what advantage do you see in your life? What is best for you and everything? And then sometime if they tell me, blah, 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 not so much, then I say, maybe you should go for TM. Anyway, so but meditation is always, there's no wrong in this. But I just think that TM is very powerful. Okay, thank you very much.
Wonderful. Thank you so much, Dr. Gagné, for enlightening us with all of this research. And there was a question that came in earlier in the chat while you were speaking, someone asking why this isn't integrated more into our healthcare system. If it's so beneficial and so scientifically backed, why don't we see more doctors recommending it all the time?
I, it's a very good question, and I understand it. I'm wondering myself, how come we didn't light up anyway? But I have some explanation. Meditation, TM was there before, and then when they came with mindfulness was publicized as a non belonging to nobody, nothing, anywhere.
Non-denominational.
Secular. I think they call
Yeah.
it secular also.
Yeah.
But there is nothing religious about TM. But anyway, I think they were just trying to find a niche or something. Anyway, because they said it's secular. And also, mindfulness is considered to be the third level of cognitive behavioral therapy. Okay. Cognitive behavioral therapy started in the 80s they started by being behavioral, meaning the psychologists, they like to They like to change your behavior. When you have stress or anything like that, they tell you to avoid this situation or this one. And when they change the behavior, hoping that you're going to be able to deal more with the problem. So that was behavior. Then in the 90s, it became cognitive, saying that probably behavior, because it didn't work very well, the behavioral. So the cognitive, they said, you work on the feeling that you feel, feel this feeling, and then what is it, and then understand the feeling, and then maybe you would be able, if you understand the mechanic of the feeling that you have of stress or something, you may be able to deal with it. So that was in the 90s. In the 2000, it became mindfulness. They say mindfulness is a way of, instead of dealing with the feelings, the thoughts, you distantiate, you develop a distantiation from it. Okay, you it's there, but I don't care. Something like this. I mean, I'm maybe exaggerating a little bit, but and it does work to some extent. So that was implemented by the psychologist into medicine. And physicians think it's very logical. What I explained to you now, they say, well, makes sense. It's perfect. Why bother? We have a way. And it does work for in some instances, but it's always a little effect size is moderate. For the same problem, TM will give a large effect size when they compare the two. But scientific scientific community and medical community, they got caught into this logic of distantiation. And I think the best way to distantiate is to reconnect the default mode network. The default mode network is, the scientists call this a sentinel. It's a witness, actually. It's always there. It's your moral reasoning. But when you're very much in activity, you forget about it. But if you think, it's going to come back and then you take a better decision. That's what we usually do. TM teaches you to have access to that anytime. And this is where the distantiation comes. You never get caught 100% into the action. There is always this little, I call it your guardian angel or something like this, that is looking over your shoulder and tell you, don't do this. You're going to get into problem. And if it's the default mode network is they're both you have another network. It's the activity network, task-oriented network. When you open up the task-oriented network, normally the default goes to the back because that's why Marcus Rage say you get lost, you lose yourself in activity. It's great because that's exactly what they teach in TM. Maharishi was saying this 50, 60 years ago, and he discovered that in 2001. He said, you lose yourself in activity. And so that's true distantiation. True. Anyway, so
True.
maybe it's going to take a bit more time, but we'll get there. We'll get there.
Yes, great. Let's see. We only have a few more minutes left, so I just wanted to answer a couple questions in the chat that are specifically about TM itself. So if anyone is interested in learning more about Transcendental Meditation, or you want to take that next step to learning, then the next step is to attend a free preparatory session with a TM teacher. And these are done in various places. I'm going to put a link in the chat that will take you to our website where you can find a TM teacher near you and connect with them. And if you can't see the chat, then go to our website, ca.tm.org. That's the Canadian website for Transcendental Meditation. And you'll find that you can track down a teacher, find a location that's near you, and have all your questions answered in a live session with a teacher. So you can ask your questions and learn more about how the course is structured. Just briefly, TM is taught over the course of 4 days with a few hours each day. And so on the first day, it's instruction day. That's when you learn the technique from a teacher. And then the following 3 days, you can either do these 3 days of follow-up, either in person, or some centers also offer a hybrid option where you can do those 3 follow-up sessions through our TM app and some Zoom sessions as well, if you aren't super close to a center. And so someone had also mentioned the course fee as well. There is a course fee involved, and it covers the 4-day course, all of your follow-up sessions, and then lifetime support from teachers. So this isn't just from the teacher who teaches you. This is teachers all across Canada. In 5, 10 years, 20 years from now, if you have questions about your TM practice, or you don't understand an experience, or maybe you stopped practicing and you want to get back into it again, then you can always reach out to a teacher. You can connect with a center and get support in that way. So this is lifetime support and access to teachers. And so the course fee right now, there is a discount going on until the end of March. And so if you're interested in learning, now is a great time to learn. Some centers, depending on their options, some local centers might have some additional funding, depending on if they have some support in that way. So connect directly with your closest center to find out more about that. And one person had just asked if you know how someone knows if they're transcending, how it feels to transcend. And during the course, you're with the certified teacher, and they're walking you through the steps of the course, giving you knowledge. And the teachers can tell if you're practicing correctly, and they can tell if you're not practicing correctly. And we have ways to support you and to make sure that you do practice correctly. So you don't have to worry about not doing it correctly. The teachers know how to support you and to fine-tune things to make sure that you are getting the experiences. And TM is a very simple technique to learn. Kids as young as 10 can learn TM, and below the age of 10, there's a lovely children's technique that can be learned for the little kiddos, which is really sweet too. So it's very simple to learn, people of all backgrounds, all education levels. You don't need a PhD in philosophy to practice TM. It really is accessible for everyone. So I really recommend connecting with a local teacher, asking your questions, and finding out more about it. I just want to take another glance through. Someone had asked about up-to-date studies. There's always new research coming out about TM. Dr. Gagné, did you want to mention any just studies in the last couple of years that might have come out? Actually, that study on the DNA that you mentioned, that
Yeah,
came out in 2023, so that's
yeah.
recent.
That's actually 2 studies. One was because for a reason of time, I had to summarize it. But one was the entire genome is changed, and it's changed in more immunity, more a bunch of. I have slides on this, but and then when they saw that this big change there on the DNA, they wanted to know about CTRA, and then they published another paper on CTRA. So you have two. These are, but it's very technical. But basically, this, I think it's the latest thing that came out, 2023.
And there's studies
Um,
coming out every year,
yeah,
and there's always ongoing studies. Right now in the United States, there's a lot of big, large-scale studies going on because they're wanting to get TM approved for health insurance so that people can claim it and get a refund on their health insurance. So there's huge studies being done in the US right now. heavily funded, trying to, I believe they're in stage 3 right now of testing. So they're really trying to make that happen. So there's always research that's going on. And one of the things that's really amazing about TM and that Dr. Gagné talked about is that TM is very systematized. And so this research has been going on since, I think, the late 1960s when the first few studies started to come out. And it's been going on till now. And all that research has been built upon because TM that was taught back in the 60s when they first started researching it, it's the same technique that you're learning today. And so that scientific research is not out of date in a sense. We can build on it and keep studying and keep repeating these research studies. And so not only are we looking for modern studies that are done with the most recent instruments and most sensitive technology that we have these days, but we're also building on this past backlog of really incredible research as well. Whereas other meditation practices, some have sort of shifted and changed a little bit over the years, or they might not be so systematic in their teaching. So it might be hard to tell if the studies that were done 40 years ago on these meditations, if it's the same exact practice that you learn today. So that's why we always teach TM and that we recommend you learn it from a certified TM teacher so that you know you are receiving the technique that is studied in all of these research studies, and you know that you'll receive these benefits. So that's why we recommend connecting with a certified teacher and going through the course in its entirety. All right, any closing remarks you wanted to make, Dr. Gagné, before we end this?
I would say to you, from my own experience, from my experience with my patient over the time, people in my family who took to TM, I will suggest take TM and start enjoying the rest of your life because you don't know what you're missing before you try. It's a unique experience, and as you can see, it makes your personality, the best part of you, shine. People will say, "Wow, you've changed. Wow, it's just so nice what you're saying. It is so, I didn't expect that from you." And all of these things, it's just, in a short word, they call it enlightenment.
Wonderful.
So thank you very
Well,
much for listening.
yes, and so on that note, we will close. So again, if you want to learn more, we recommend connecting with a local teacher, and hopefully we'll see you in one of our local centers sometime soon. So enjoy the rest of your day wherever you are in Canada, and we hope to hear from you soon. So all the
Thank
best.
you.